Hello, everyone, and welcome to CancerSpeak, the official podcast of the American Cancer Society journals. I'm Dr. Nirali Shah, and I'm very pleased to be joining you today to introduce and discuss Pediatric, Adolescent, and Young Adult Cancer, a new open-access multidisciplinary journal of the American Cancer Society dedicated to advancing research and improving outcomes across the pediatric, adolescent, and young adult, or AYA, cancer continuum. I'm honored to serve as the inaugural editor-in-chief and excited to work with colleagues across the field and adjacent disciplines to move this work forward. And today I'm joined by two of my colleagues, Dr. Bill Dahut and Dr. Suresh Ramalingam. Bill and Ram, I'll invite each of you to briefly introduce yourselves and share your perspectives on the importance of this journal to the field.
Thanks, Nirali. Really excited to be here today, but actually much more excited about the launch of the journal. So my name is Bill Dahut, and I'm the Chief Scientific Officer at the American Cancer Society. I'm a medical oncologist by training. And my role at ACS to oversee all of our research funding, which includes our extramural grant funding, as well as our intramural program, which I think is best known for its cohort studies, its guidelines, its cancer facts and figures. And I think today what we're talking about is our journals. I think we're really excited for the launch of this journal because I think there really needs to be a place for young adults, adolescents, and pediatric patients with cancer, the physicians, the doctors, everyone who takes care of them to go to really understand the best ways to really move forward in this population. We're the largest nonprofit funder of cancer research outside the U.S. government. We have over $520 million currently out in grants. So we're really excited to find ways to integrate all the wonderful folks we are funding across the country with the new journal. So hopefully we can work together to find ways to really encourage them to submit their most exciting research. And I'm sure they'll find your journal really a home for some new exciting ideas that hopefully will be transformative for the field. I'm going to turn things over to my good friend Ram to give his insight as an editor for one of our most esteemed journals, Cancer.
Let me first start by congratulating you, Nirali, for being the inaugural editor-in-chief of this exciting new journal and newest addition to the American Cancer Society family of journals. My name is Suresh Ramalingam. I'm a professor in hematology and medical oncology at Emory University's Winship Cancer Institute. I also serve as the executive director of the Winship Cancer Institute. I have been fortunate and privileged to be the editor-in-chief for Cancer for nearly 5 years. Cancer, as you know, is among the oldest oncology journals and among the most prestigious oncology journals in the world. Even before my role as editor-in-chief, I worked with Cancer for almost 10 years as the section editor for thoracic oncology. So I'm happy to say for almost 2 decades, I have had the privilege of working with the ACS group of journals. And I'm truly excited about the new journal that you're going to be leading, Nirali, for a variety of reasons. One, of course, is there is a lot of well-deserved attention to the problems faced by the pediatric cancer population and also the survivors and young adults who have unique medical issues themselves. Over the past few years, I've seen the increase in research productivity, new publications, new submissions to cancer. And I feel like given the importance of this area, having the new journal will provide an entirely different and elevated forum for researchers and academic scholars to contribute and have conversations around key topics. So I'm looking forward to the first issue coming and seeing how this journal is going to play a key role in this critical, important field of oncology.
Well, that's a perfect segue to the first question that I wanted to discuss with the two of you. Bill, let me start with you. What would you characterize as a current state of pediatric and AYA cancer research? And where do you see are the most critical gaps or unmet needs that we can help address both in general and through this journal?
Nirali, I think it's really a great question. Oftentimes, medical oncologists like myself sing the praises of the research done in pediatric oncology. But oftentimes, we're reflecting back on work that was done 30, 40, or maybe 50 years ago, as we had great breakthroughs in the field of pediatric leukemia treatment. But over the last 10 or 15 years, I think increasingly there's been a need for new breakthroughs in the solid tumors, in some of the refractory leukemias, in AML particularly. And while there's been great advances in things such as your own work in CAR-T and otherwise, there really needs to be an increased focus in areas. These are not cancers that we've beaten, and there are too many pediatric and young adult patients who we need better therapies. But what I really like about the journal is that we're not focused only on pediatric type tumors, but also young adults and adolescents who develop cancer, regardless of that cancer in this age group. And I think that's something that we hear more and more about, the impact of cancer, epithelial cancers, particularly on the young adult population. So thinking about the impact impact not only on the treatment, but also on the financial, the social, the sexual, the other aspects that young adults uniquely feel when they have a colorectal cancer or breast cancer. So it's the perfect time for this journal. We need more research in a lot of these areas. And I really think this is going to be a great place to bring some of these most important ideas together.
I'm really happy to hear you say that. As you know, when I went through the process of applying to and then being selected as the inaugural editor-in-chief, that was really my big goal. I wanted to take this journal and think about it from the perspective of the patient, the child, the adolescent, the young adult who develops this cancer, and what are the issues that they face. And there are a multitude of them, right? Including the psychosocial aspects, the financial aspects, the transitional care elements of it, as well as the actual therapies. And so as we develop pediatric, adolescent, and young adult cancer, I'm really hoping that we have a broad reach in terms of thinking about the multitude of factors that is impacted by a new cancer diagnosis in this vulnerable population. Ram, anything that you want to add to that?
No, I completely agree with both you and Bill as to the importance and the timing of it couldn't be better. I think we have an opportunity to leverage the journal's presence in this emergence of the journal in this topic to shape the landscape. And that's truly exciting.
Now, Ram, just to follow up with you, and you alluded to this with your introduction, how do you see this journal complementing cancer? What does that mean for ensuring important research reaches the right audiences?
What I expect is with this journal's topic, we're going to bring new readership into our journal's family. People who have specific research interests, clinical interests, are going to be interested to see what are the emerging new directions in the pediatric young adult populations. The issues beyond, as Bill alluded to, just treatment of cancer, to what are the steps needed to make sure those who go through this journey are incorporated back into the society? How do they become reintroduced into the workforce, into regular life? So all of those topics, we see a number of articles coming in now addressing those to cancer. And while some of these are of interest to a broader audience and can go in cancer, some of these are very specialized and would be more suited to the readership that's specifically looking for that. So I think this would be a nice way for you and the journal to not only seek out the kind of topics you want to see, but also to identify areas where the field has opportunities to grow, invite reviews, editorials, commentaries, shed light on areas where there is limited information. And I feel that that would have an effect on even moving research in those specific directions. So a lot of exciting ways by which I think this journal is going to be highly impactful is how I look at it.
As I think about reaching audiences, and for those working in pediatric and AYA oncology, and why you would consider this journal or the type of work that we hope to see submitted, I'm approaching this with a very broad focus. As I've met with people and talked to them about it, there are a few key areas that I think are particularly interesting that could be highlighted. These include, recent changes in policy or regulatory affairs where they may impact the way we deliver care or that care is provided to pediatric adolescents and young adults. Other areas that include funding mechanisms or grassroots types of advocacy groups and how we can encourage them to play a role in terms of disseminating that information and their contribution to the pediatric and AYA cancer. As the journal gets started, we are hoping to have a call for several special series where we can then start to collate information. I think it's going to be particularly important that we are capturing patient voices as well as caregiver voices. So we'll have sections that are dedicated to that as well as including patients and caregivers or advocates as authors on manuscripts that come in and as part of our editorial board. So again, I'm hoping that this very much fits an unmet need, but also approaches the landscape of journals with sort of an innovative approach where we are able to really help communicate science in a way that is understandable in getting our message delivered.
What I've noticed is that some of the boundaries that were more common when early on in training, we don't see anymore. So, I know early on as a medical oncologist, once a patient hit 19, it flipped over to medical oncology, and anybody younger than that, sort of regardless of the disease, was taking care of the pediatric patients. But I know, you and others are treating diseases primarily pediatric origin in people into their 20s and their 30s. And there's really a large number of physicians who are really focused on, what we're largely calling early onset cancers, who have populations of colorectal cancer patients, lung cancer patients, certainly in their late 20s, early 30s. Most of those are trained in medical oncology. So really finding a home where we move beyond sort of the artificial barriers of age and really focus more on the patient and how best we can help him or her, I think is what I really hope that the journal is able to do.
Yeah, and I think in that regard, right, you're talking about bridging the gap. As we see these early onset cancers affecting younger and younger patient populations, I think, right, both fields from pediatric oncology and medical oncology can really help to inform one another about what is the best way that we can optimize the needs of the patients that we're treating. Bill, let me ask, in terms of just ACS and the broader mission, how does this journal support that? And what would be a goal for you with regards to pediatric, adolescent, and young adult cancer?
Well, the goal for ACS is end cancer as we know it for everyone. And I think, as I'm sure you know, the pediatric young adult population is particularly important to us, not that other populations are not, because not only do we have sort of an impact on sort of a short term, but the ability really to have somebody to live a very long and productive life, assuming that they can get the care and the follow-up care we can get. I think we're all troubled by data that we've seen from some of the pediatric studies where even those patients, cured from leukemia actually don't live as long as sort of age-matched group. So we need to really focus a lot more on survivorship for people, when they're on active therapy and beyond. And that's an area I think of particular importance for ACS. We do have a new CEO. We're actually going through our strategic planning as we speak. And there are certain core things that are very patient-centric that I'm sure will be at the center of it. And finding ways, I think, to really, find cancer earlier, prevent cancer, and really improve treatment with a focus on really vulnerable populations such of these, I think is really something that for ACS is incredibly important.
Ram, any final thoughts that you'd want to share?
I think the ACS family of journals, whether it's CA, cancer, or cancer cytopathology, all are intended to reach a broad global audience. And they do that very effectively. I think these journals play an important role in shaping conversations on key emerging areas for cancer, end-to-end, from cancer risk reduction, early detection, prevention, all the way until treatment, survivorship, and integrating people, the socioeconomic considerations, disparities. So to have another dedicated journal specifically related to pediatric, adolescent, young adults population is really going to help move this field of research to a new level. I think the journal is going to have a significant impact on spearheading research, and that is good for the field. So even though it's appealing to a broad audience, it's going to draw an even more focused audience on this topic into the ACS journals, and that's going to increase the reach of all the exciting work that happens. I always say for us, the goal is to bring the best of the science to the broadest of the audience, and your journal is going to do just that.
Well, thank you so much. And with that, Bill, Ram, thank you for joining this episode of CancerSpeak and sharing your perspective today. For our listeners, we invite you to learn more about pediatric, adolescent, and young adult cancer and to consider the journal as the home for your next paper. As an open access journal of the American Cancer Society, it is designed to support the broad dissemination of research that informs clinical care and improve outcomes for pediatric and AYA population. We are now accepting submissions and welcome your work for consideration, and we look forward to publishing our first issue in late summer of 2026. We encourage you to follow us on social media and stay up to date on new journal developments and for our first published papers. We'll include links to the journal homepage and our social media pages in the show notes. I would really like to thank the American Cancer Society and the editorial staff for this incredible opportunity. I am very excited about pediatric, adolescent, young adult cancer and what it will mean for our cancer community and all that will be forthcoming from it. So thank you.